to demonstrate how to deliver a baby through spontaneous vaginal delivery with EINC. This box represents the mother's abdomen. This is the umbilicus and this is the symphysis pubis. This hole represents the vulva. Let's assume that I am the single birth attendant and the patient is already on the second stage of labor, already crowning. Let's prepare for the delivery. Ensure that the room temperature is around 25 to 28 degrees centigrade. Do the linear arrangement. 2 pairs of gloves, 2 dry linens, bonnet, oxytocin injection, plastic clamp, instrument clamp, scissors, and 2 basins. Wash your hands prior to the delivery in accordance to the WHO guidelines. Now, put 2 sets of gloves. Drape the clean linen over the mother's abdomen. Encourage the mother to push as hard as she can. When the head extends the vulva and perineum, a gloved hand may support the perineum. The fetal head falls posteriorly. The occiput promptly turns toward one of the maternal thighs and the head assumes a transverse position. The sides of the head are grasped with 2 hands and gentle downward traction is applied until the anterior shoulder appears under the pubic arch. Next, bent upward movement. The posterior shoulder is delivered. The rest of the body almost always follows the shoulder without difficulty. Once the baby is delivered, call out the time of birth and the sex of the baby. Baby boy out 7 a.m. Place the baby on the mother's abdomen. Use the first linen to towel dry the body of the newborn. Within 30 seconds, thoroughly dry the baby, the eyes, the face, the head, the front, the back, the arms, and the legs. Do a quick check of the newborn's breathing while drying. Remove the wet cloth. Initiate skin-to-skin contact by facing the baby prone to the mother's abdomen. Place the bonnet on the newborn's head. Use the second linen to cover the baby's back. Palpate the mother's abdomen and exclude the second baby. Use the wet cloth to wipe the soiled gloves. Dispose properly. Give oxytocin intramuscularly on the deltoid. Remove the first set of gloves. Palpate the umbilical cord to check for pulsations. After pulsations stopped, clamp the cord using the plastic cord clamp at 2 cm away from the base. Place the instrument clamp 5 cm away from the base. Cut near the first clamp. Wait for strong uterine contractions. Applied controlled cord traction and counter traction on the uterus until the placenta is delivered. Placenta out 7:15. Massage the uterus until it is firm. Check for bleeding, tears, and lacerations. Check for the completeness of the placenta.